All right, Jason. So here we are on the inside of your shoulder just to orient you. So on the right side of the screen, this is your glenoid or the socket. And on the left side of the screen is your humeral head or the ball. And what you can see is the arthritis we had seen on your images. So if you look here in the front, this is where you have relatively normal cartilage still. But as you come to the center, you can see the demarcation between the good cartilage and this spot here. And this is all worn out. So this is kind of, it looks like a mortar and a pestle. So all the cartilage is worn out and you just have raw bone here. This doesn't always hurt, but it leaves a lot of chemicals in the joint from the dying cartilage that cause pain. When you go all the way to the back, you can see that there's some islands of cartilage left, but for the most part, you have pretty significant arthritis in the center of the socket. On the other side, the humeral head, I'm struggling to see any cartilage anywhere. This is all raw bone. So if I go in close enough, you might have a little bit of normal cartilage right here, but as soon as you get into the center of it, this is all worn out cartilage here. So again, significant arthritis, but we're going to try to clean up what we can and not worry about that part today per your request. This is your torn labrum, okay? So this white tissue here in the center should not be detached like this. A lot of times it's hurting because there's a big flap that's catching and moving inside your joint as you bend and straighten your arm. So this big piece needs to be removed. Once we get that out, we'll get a better look at your biceps tendon, which is above us, but you can see there's already a lot of fraying of your biceps tendon up here in addition to this labrum tear. So we're going to do a little bit of cleaning up first to kind of see the joint a little bit better. So now I'm using what's called a shaver. It's like a little motorized vacuum, and I'm using it to debride some of that torn labrum, and we're going to get that piece kind of partly cut from the stalk and then remove it all together. This thing is just eating away at it a little bit, but it's a pretty big piece. Yeah, if you wouldn't mind. So what I did is I removed that big piece, and now I'm cleaning up the frayed labrum in the front. And then you also have a lot of synovitis here. That's this red, kind of inflamed looking tissue. And a little bit of what we call calcific tendonitis, or deposition of some calcium pyrophosphate crystals. That's that kind of shiny stuff that you see in the cartilage. Sometimes that just comes from the disease process itself. Other times it comes from repeated cortisone injections and things in it. But that tissue itself can be a little bit irritating, so cleaning that up is often very helpful. I'll see the radio frequency wand now. Oh, thank you. So now I'm using this radio frequency wand that uses radio frequency energy to ablate and seal tissue. So I'm cleaning up all this frayed remnant of the labrum that tore off the front, and you can see it kind of smooths it out quite a bit. Unfortunately, it doesn't add tissue back on, but at least it cleans up what you have, and that's the front part of your labrum there. Now, if we look at the bottom part of your labrum, there's still a lot of fraying of this tissue as well, and I'm going to spend a little bit of time cleaning this up. This is where you still have some cartilage left, even though the top part is pretty worn raw. This bottom part, there's still some cartilage here. It's just really frayed, and I'm going to determine whether or not we need to fix that at all. All right. I'm going to move his arm. So here I'm looking at the inferior anterior labrum here, which is this tissue, and it should be adherent to the socket here. In your case, it's torn and frayed quite a bit. I'm going to expose that area better and clean that up, and then decide if we need to sew that tissue back or not. All right, I need to. So here I am looking down at the inferior part of your labrum, and the inferior labrum actually is intact. The anterior inferior labrum, which is the part I'm kind of cleaning up right now, is frayed and a little bit separated, but I'm going to see how badly it's separated and determine if we need to fix it, like with stitches, or if just cleaning it up is going to be okay. All right, I'm going to take that. No, I think we're good. I think I'm just going to take the RF one now. Cool. So again, I'm just cleaning up. You can see there's not a lot of cartilage down here. The little balls of white you see on the right-hand side are where you have little islands of cartilage left, but there's not a lot. I'm going to try to stimulate more to grow, though. We're going to use some of your stem cells, and then we're also going to do what's called a microfracture. If I get down in here deep, though, this labrum is not detached. It's just frayed, so we don't need to sew this tight. And sometimes you don't want to constrain a joint too much when it's arthritic because it can make the arthritis hurt you more. So I think instead I'm just going to clean up this labrum here and then focus on trying to get some cartilage to kind of grow in those islands in the center of your glenoid where there's no cartilage. So again, this is the bottom part. This is the back. And as I march my way back up, you can see that most of that cartilage is worn out. Now let's focus on the top where your biceps tendon is, because that's pathologic too. So now I'm looking up top where your biceps tendon is, and you have a lot of inflammation up here. That's what all that kind of red and white kind of balls of tissue are. And what I'm going to do is put the radio frequency wand up in there and clean some of that out. This is kind of where your biceps tendon is fraying off the insertion on the socket. And I'm going to clean some of that up, and we're going to determine if this tendon is fixable here in place or if we need to repair it in a slightly different position. So I'm below the tendon now, and now I'm going above the tendon, and I'm going to get some of the inflammation up top here removed as well. It's all this kind of white and pink balls of tissue. That's synovitis or synovial tissue that's inflamed, and it kind of thickens and gets red and pink and irritated. All right, Jason, so here we are looking at the top of your labrum. So this is your biceps tendon coming in here, and the biceps tendon itself is okay until you get to the superior labrum right where it attaches on the socket. So right here it's starting to delaminate, and you can see and start to fray. So typically in a lot of these I'll just cut the tendon and tenodese it further along the ball or down the groove, but I understand your wishes to try to keep all the anatomy where God put it. So what we're going to do is we're going to put some stitches here and sew this tendon back to itself and anchor it back to the socket so that we can prevent this tissue from tearing further and repair it kind of in situ where it is. So again, we're going to be pulling this tissue together. You can see it kind of starting to tear there. So I want to clamp that down to itself and then anchor it to the socket. So what I'm doing is I'm passing a stitch through the tendon, and we're going to use this stitch to tie your labrum back to the socket. Oh, stop. Okay, go for it again. You bottomed out on it yet? Okay, yep, you can come out and then put the red straw in there. And then you're going to have to hold it because that's going to want to squirt out. Okay, and then the same thing like you did at the beginning, you got to pull that out without letting the red thing come out. Okay. All right, and then you can put the anchor on. Okay, perfect. So I'm going to let you hold the red and then hold the stitches, and I'm going to come down here, and then once I've got the angle set up, you can move the red. All right, you can move the red. All right, and then I'm going to have you put a little bit of tension on those stitches. Okay, that's good. Okay, a little bit of tension now, and then as you mallet it in, put a little bit of tension on it. All right, now let go of your tension. Not all the way. All right, mallet it in. Keep going, keep going. Good. All right, stop. So I've got one suture in locking your tendon down, and now I'm about to put another one here. So I'm basically putting a stitch through the tissue. In this case, I'm passing a wire, and we're going to shuttle the suture. And then we're going to anchor it back to your top of the socket again. So we've got the second anchor going in. Go ahead and mount that down. It's that little white tab. Good. And then we're going to cut off the excess suture. All right, you can load that back up in there. All right, so we've got your second stitch in, and now we're just going to cut off the excess suture. Pull tension. There you go. There you go. And so we've got the tendon anchored up here, and I'm going to put one more anchor in the front. Still a little ratty looking, but it's tied down. Let me see the arthrocare guy. So we're going to drill your final hole here. Slow. Keep going. Stop. Okay. You need to pull some tension on the stitches too. Did you pull it out? So here you go, just we've locked the biceps tendon down. We use 3 stitches to anchor the top part of the labrum and the biceps down. You can see one of the stitches right underneath there, but it's basically holding the biceps down to the top of the socket. Now we're going to clean a little bit of this cartilage up down here and do a little bit of microfracture to try to stimulate some cartilage to grow there and fill that area in with some scar tissue. Let me see the ringed curette. It's the So here I am using a curette. It's kind of like a ice cream scooper, and I'm trying to kind of clear off the failed attempt at your body to fill this area in with scar tissue cartilage, just little islands of rough cartilage and bone, and we're going to try to stimulate more to grow by drilling some deeper channels and trying to get some bleeding in there to try to fill that area in. It doesn't really work as well when you have disease on both the humeral head and the socket, but we're going to try to honor your joint preservation request and try to get your body to do what it can to kind of fill this area up. There's a little cyst here. All right, I'll take the shaver. There we go. So Jason, here we are. We're using a microfracture awl to tap through the subchondral bone into the bone marrow. We want to try to see fat and bleeding and marrow elements coming into this area because it'll help to fill this area in with some scar tissue cartilage. There's a couple areas where your body did that on itself already, and we're going to try to stimulate that in some other spots too. It's hard to do it on the humeral head and the glenoid. It works better when it's just one side, but we're going to do as much as we can right here on the socket side, and then we're going to add your PRP to it to kind of give it a boost as well. So now we're down at the bottom. And you'll see kind of toward the end that this area will start bleeding a little bit. There you go. Good. So I'm cleaning up those little pieces of bone that debris from where we did the microfracture. You can see how I've kind of poked holes in here, almost like aerating a golf course. And we're going to try to get some scar tissue cartilage to fill that area in. There's a little cyst that your body's developed right here. We're going to try to get that to bleed too. You can see some blood elements in it already. But we basically want that area to fill in with some scar tissue cartilage. Okay. So we're finished in your shoulder. Your subscap tendon looked good and the rest of the labrum looked good. So now I'm in what's called your subacromial space, where we're above where your rotator cuff is. The rotator cuff is below me, and I'm exposing the acromion, which is the top part of your shoulder blade up top here, and we're going to clean up all this scar tissue and bone spurs. A lot of times this is more of a problem than any damage to the cuff. So I want to get a good look at this. There's a little bit of fraying of the cuff on the inside, but this is really where we get to evaluate the rest of the cuff and decide if there's enough tearing to do a repair. So more to follow in a little bit. So Jays, here we are in your subacromial space. So just to orient you, this is the acromion up top here. I've removed some of the bone spurs. I haven't taken all the ligament down yet, but just getting a good view. And then this is your rotator cuff. And overall, there's just a little bit of fraying. I don't see any areas where there's a significant amount of wear and tear. It gets a little thin right here where I'm putting this probe, so I'm going to explore this area a little bit better. If anything, I might have to just put one anchor in there. I think just because of your activity, you know, I'd like to kind of be able to not have to restrict you as much, and I'd be worried that if you went back and we left this part alone, even though it's a small tear, that it might come back to haunt us. So I'll probably put one anchor in here, but for the most part, the rest of the cuff looks pretty good. So this is the area where your rotator cuff was starting to tear, and this device I shouldn't be able to fit in here. It's not a huge tear though. This is about 3 to 4 millimeters in diameter, and I can just barely fit it in here. So it's an early tear, which is the best time to fix it. And we can fix it through a minimally invasive, you know, approach with just using likely a single anchor. So I think this would be a good way to anchor it down for you and not have to worry as you progress in your rehab about whether or not your rotator cuff fraying is going to get worse. So now we're tapping an anchor for your rotator cuff. The bone's a little soft here, but we got it. And then you'll see we've got a stitch is up top here. And then if you want to just hold on the tension. We have a little bit of a suture bridge again. So you can see I put a stitch to the top of the rotator cuff, and now we're going to put this anchor in the hole that we drilled down here and anchor it in place. All right, so you can pull on those stitches a little bit, real tight. There you go. And then I'm going to lock you into that hole. So now it's a two-part anchor. The plastic part's all the way in, and now we're screwing in this biologic plastic, or biologic kind of bone component of it, and it tightens it in the hole, and once it's buried, we'll remove it, go a little bit further, a little bit, keep going a little bit more. I like to bury it more, keep going. A little bit more, a little bit more. Yeah, see, I was putting a little bit of tension on the stitches. Good. Okay, that's good. So we've anchored down your rotator cuff. Again, it was a small tear, but we've anchored it down really nice. And now as I bend and straighten your joint, the cuff is locked down really nicely. And if we look laterally directly at the anchor, you can see how the stitch is locked in place with that small anchor, and then it holds the edge of your cuff down and kind of plastered it onto itself. It looks really good.